neuronal plasticity is a hallmark of normal brain development. So weak or non-functioning synapses are attacked by this protein called C1q, which is the initiating molecule for the classical complement pathway. When this protein is tagged on the synapses, microglial cells will get recruited to the synapses and engulf the synapse, or that it will start the formation of the MAC complex, leading to cell lysis. In neurodegenerative disease, we believe that this pathway gets reactivated aberrantly, leading to the destruction of the synapses as well as neuronal cell loss. ANX005 is a monoclonal antibody targeting the protein C1q I mentioned earlier. We have found it to have excellent penetration into the CNS. So in the study, eligible subjects are enrolled and being dosed biweekly for 24 weeks.
So this was an open label study, and patients were initially dosed with a 23-hour initial loading infusion and then dosed every 2 weeks for a period of 24 weeks. Then there was a 12-week off drug assessment and safety phase in which we looked at the persistent effects, both clinically as well as on biomarkers. And what we saw that overall the drug was well tolerated. There were some adverse events, predominantly in those individuals who had a high baseline ANA, so there seemed to be an autoimmune effect. We also found that in general, there was stability of the clinical function, so there wasn't deterioration, and this is true and good compared to a similarly disease and age-matched control cohort in observational studies, such as from the TRACK HD cohort. We also found that from a biomarker perspective, overall, neurofilament light remained quite stable, which is good because we would expect over time there should be gradual increase in this biomarker. We found that there seemed to be separation, and there were two different groups. The group that had a higher baseline level, the C4a to C4 complement ratio, compared to those who had a lower level. Those individuals with a higher ratio had higher baseline level of complement activation, suggesting that neuroinflammation may be playing a greater role in the progression and pathogenesis of disease. And indeed, in this upper half of the patient population, we saw that those patients were seemingly responders with improvement in the cUHDRS as well as the total functional capacity score, and these people improved greater than their baseline, and this was statistically significant compared to those people who had low baseline C4a-C4 ratios. And this improvement was seen soon after drug therapy began, and this continued not only to the end of dosing, but continued into the safety phase up to 3 months post-dosing.
Yes, I would also add that in later study, when we're looking at other longitudinal study, patients who have high baseline C4a tend to be patients that had worse prognosis without treatment. And so we are very pleased to see that these are the patients that were actually showing improvement. And we're also looking forward to leverage this precision medicine strategy to further development ANX005.